Hello and welcome to this video. I'm so glad you're here and I hope you're ready and eager to learn. Today we'll be talking about false positive pregnancy test as a result of phantom hCG in relation to cryptic pregnancy and all pregnancy. A false positive pregnancy test or a positive hCG test when you are not pregnant rarely happens, but if it does, it can be seen both by blood and urine tests, though the causes in each case can be very different. So let's take a look at some false positives versus false negatives. A false positive pregnancy test means that your pregnancy test is positive, but you are not pregnant. A false negative pregnancy test means that your test is negative, but you are pregnant. A true positive pregnancy test means that your pregnancy test is positive and you are pregnant. A true negative pregnancy test means that your pregnancy test is negative and you are not actually pregnant. Most women who receive a positive pregnancy test result at home are actually pregnant, and only a few are not. One cause of a false positive pregnancy test is simply reading the home pregnancy test incorrectly. Make sure to follow the manufacturer's instructions and do not read the test after the allotted time frame for that specific brand of test. Any positive line that appears after that time frame would be considered inaccurate and cannot be considered a true positive. It is also important to note that a false positive pregnancy test can happen after an hCG injection. False positive urine tests can also occur due to fertility treatment. If you receive shots of hCG or gonadotropins for ovulation, improper testing, a defective or expired pregnancy tests, not following the manufacturer test's instructions, testing too early in the cycle, or reading after the instructed time. False positive urine tests can also happen due to chemical pregnancy. This is a true pregnancy that has a positive pregnancy test result, but the embryo does not attach to the uterine lining and develop. False positive urine tests can also occur due to certain rare medical conditions such as gestational trophoblastic disease, pancreas islet cell tumors, gonadoblastoma, adenomyosis, bladder and lung cancer, and after a blood transfusion. Another reason for a false positive urine test would be menopause. Some women age 50 or older in menopause may have a slightly elevated blood hCG test, which usually is not associated with a pregnancy. Now let's discuss what would cause a false positive blood test. Answer: phantom hCG. Phantom hCG causes a positive blood pregnancy test without being pregnant. Patients with phantom hCG will have a persistent yet not significant rise in hCG blood pregnancy test while the urine test is negative. The reason for a phantom hCG is when some individuals react falsely positive to substrate in the blood hCG test and thus will display a consistently low positive blood pregnancy test even though they are not actually pregnant. The urine test will be negative, and this is why a urine and blood test should always be done together. So that's all for this video. I hope this helps somebody somewhere with this very, 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 very helpful information. I think this could help every woman around the world to know that phantom hCG is something that happens and that you should request that your doctor do a urine and blood test together. If you have any questions, please leave them in the comments below. Thank you so much for watching this video. Thank you so much for being here. I hope you're happy. I hope you're healthy. Stay blessed, friends. Bye.